homeopathic medicine that has profound, dramatic effects on the blood. So if you've ever wondered how a snake venom is utilized to literally halt a medical crisis, you are definitely in the right place. Let's get into it.
We're kicking things off with Section 1, a hopeless bleeding case. Let's look at how fast this actually works in an emergency.
Picture this timeline. You have a patient suffering from stomach cancer with liver metastasis. It's so severe they've been admitted to the hospital 4 times in just the last month. The core issue? Unstoppable hematemesis. That's vomiting blood, along with diarrhea that literally looks like dark coffee grounds. The medical team tries everything. Conventional anticoagulants? Fail. Vitamin K, vitamin C, nothing works. The blood simply refuses to coagulate. So they pivot. They administer Crotalus Harridus at a 30C potency every 15 minutes. And get this, just 3 doses later, the bleeding completely stops.
To really grasp the stakes here, listen to this desperate plea the patient's wife gave to the doctor right before the remedy was administered. Nothing is working. His bleeding is not getting stopped, and the condition is looking hopeless now. I mean, they were at the absolute brink. It was from this life-or-death state that 3 quick doses of Crotalus totally resolved the crisis. Okay, moving on to Section 2. Enter Crotalus Harridus. What exactly is this powerful substance?
Well, Crotalus Harridus is a homeopathic remedy derived directly from rattlesnake venom. But, it's not meant for just anyone. It is specifically indicated for patients whose vital force is completely exhausted. The literature calls this a broken down, deeply debilitated constitution. This happens when a person's health is severely damaged, maybe by massive blood loss, chronic alcoholism, or a deep septic infection. Essentially, their system is just way too weak to fight back on its own.
Which leads us to Section 3, the hemorrhagic diathesis. This is absolutely crucial to understand. There is a highly specific type of bleeding that this remedy targets. The blood profile? It's consistently dark, fluid, and fiercely non-coagulable. It absolutely refuses to clot. Plus, it often has a highly offensive odor, which points straight to a deep septic state. But here's where it gets wild. Crotalus is known for a shocking symptom where blood just oozes from literally every orifice. Eyes, ears, nose, gums. The literature even notes this bizarre phenomenon of bloody sweat, where blood literally seeps right through the skin's pores. And finally, you'll see sudden purpura, those purple skin splotches happening because the blood platelets are rapidly disintegrating.
Now, this brings up a really important clinical distinction. Say a patient is turning yellow. Your first thought might be, oh, a standard liver infection. Hepatic jaundice, right? Well, Crotalus causes a malignant yellow hemolytic jaundice. And that's entirely different. The yellowing here isn't from the liver failing directly, it's from the venom actively breaking down the blood itself within the system. Understanding that exact difference is vital to finding the root cause of a patient's collapse.
Let's jump to Section 4, sepsis and zymotic diseases.
So Crotalus is incredibly effective in what are historically called zymotic diseases. That basically just means communicable diseases passing from person to person. Think intense fevers like dengue, typhoid, and malaria. When a patient is collapsing, going into a low septic shock state, and you're seeing those dark, non-coagulable intestinal hemorrhages during the fever, this is the absolute go-to remedy to halt that crisis.
And if you need a visual mnemonic for this septic state, I want you to vividly picture the Crotalus tongue. It is fiery red, intensely swollen, completely smooth, and highly polished. It's a massive clinical red flag. If you see that fiery, polished tongue in someone battling a communicable disease, boom, Crotalus should immediately pop into your mind.
All right, Section 5, key distinguishing symptoms. Let's isolate some of the stranger things here.
There are some truly bizarre, unforgettable symptoms with this one, like this fascinating physical modality. The patient physically cannot lie on their right side or their back without instantly producing dark green vomiting. The color contrast is striking, right? We've been talking all about this dark coffee ground blood, but a specific resting position triggers an immediate, highly visual dark green vomit.
Then we have the concept of high game. Basically, this refers to decomposed or heavily aged meat. If a patient eats spoiled meat and ends up with a noxious, incredibly offensive septic diarrhea from that specific infective focus, Crotalus is famously known for stepping in and neutralizing that exact toxic presentation. Let's rapid-fire a few more unforgettable symptoms. It's used for apoplexy, severe brain congestion, and convulsions, especially in chronic alcoholics. It's a huge remedy for recurrent summer blood boils and carbuncles.
It treats malignant diphtheria, where, curiously enough, swallowing an empty throat actually hurts way more than swallowing solid food. It has a powerful effect on clearing up vision after severe corneal inflammation. And finally, it handles prolonged metrorrhagia, continuous bleeding for months, along with some really intense menopausal flushes.
Moving on to Section 6, Action, Pacing, and Comparisons. We need to know how to distinguish Crotalus from its closest homeopathic cousins.
Let's look at this table to lock in the differences. Crotalus is distinctly right-sided, and the patient's skin is going to feel cold and dry. Now compare that to Lachesis. Lachesis is famously left-sided, and their skin is cold but clammy and moist. Interestingly, Lachesis actually acts as a direct antidote to Crotalus. Then you have Alaps. Alaps is right-sided just like Crotalus, but it zeroes in on the right lung specifically, producing black expectoration from the chest.
There's one more crucial comparison we need to make outside of the snake family. Remember that fiery, polished red tongue we talked about for septic fevers? Well, another major septic remedy, pyrogenum, has that exact same polished tongue. So how on earth do you tell them apart? The pulse. With Crotalus, the patient's pulse matches their fever. But with pyrogenum, there's a weird telltale mismatch. For example, they might have a mild fever of 100 degrees, but a racing pulse of 140. If you see that mismatch, it points you straight away from the snake venom and right to pyrogenum.
Now, you might be wondering about the pacing of this remedy. The number 30 is really significant here. According to the source material, and specifically noted by the homeopath Gibson Miller, 30 signifies the 30 days of its chronic action.
And that brings us to a really fascinating final thought for this explainer. Think about this. How can a remedy that literally halts life-threatening ICU bleeding in just a matter of minutes, like we saw in our opening case study, also act so deeply on a broken constitution for an entire month? It's this incredible duality of pacing. It really leaves you wondering about the profound, almost paradoxical depth of how venom-derived substances actually interact with the human vital force. I mean, it's pretty amazing, right? Thanks for joining me for this explainer, and keep questioning how the most intense substances in nature can sometimes